hiyo style hatutafika. And therefore you can see, if we continued employing 5,000 teachers per year, it would have taken 20-something years to employ 116,000 teachers. Nearly 24 years. William Ruto has already employed 100,000. We are remaining with 16,000. Na hii mwaka tunamalizana na hiyo commitment. Rais Ruto ni fire, si fire. President Ruto's administration has also built 23,000 classrooms. Is in the process of building 1,600 laboratories. President Ruto's administration, the UD administration, the Kenya Kwanza administration has also ensured that going forward, we reduce the number of university students who cannot afford to pay fees. We have introduced a new student-centered funding model that looks at the needs of the individual student as opposed to sending money to universities. And today, I can assure you that many universities that were facing insolvency have come out of insolvency because of the new university funding model. We have increased the money that we give HELB, Higher Education Loans Board. In 2022, it was 17 billion. Last year, 41 billion. We have increased the money we give our universities. In 2022, it was 41 billion, 45 billion. Today, or last year, it was 82 billion. And therefore, I want to hear those who are criticizing this administration in matters education to look at Kenyans in the eye and tell us what facts, what logic are they using in their assessment. Mimi nasema hivi vile vile. Munajua wakati wa campaign, everywhere we went, wananchi walikuwa wanasema abolish CBC. Ni kweli si kweli? Kwa sababu CBC ilikuwa na mzigo, curriculum ilikuwa na mzigo mkubwa kwa wazazi. Mtoto anakuja nyumbani, anaambiwa tengeneza gari overnight. Sijui shona, sijui nini, shona kitenge, upeleke shule asubuhi. Wazazi walikuwa wanasema toa hiyo CBC. Leo mmesikia hiyo kelele ya curriculum ya CBC? Si imeisha? Mwenye kunyorosha ni nani? Mwenye kunyorosha ni nani? Rais Ruto ni fire, si fire. Aendelea si endelee. Kwa mambo ya TVET, munajua ya kwamba this government so far has employed 3,300 TVET tutors or lecturers. For a long time, the government had forgotten that sector. Enrollment ya wale wanafunzi wako kwa TVET. You know, ordinarily, kwa sababu mimi ni mtu nimekuwa hapo mbele nilikuwa nafundisha, I can say this: you should have more young people in TVETs and tertiary colleges than in universities. Si ni kweli? But we found an inverted pyramid. There were more students in university than in TVETs. Today, the figure of TVET students, which was at 297,000 in 2022, has risen to 718,000 in 3 years. Today, we have introduced far-reaching curriculum changes in TVET, including modularization, to allow Juakali artisans and other people who want to go to TVET to come in for 2-3 weeks for a module, go back and work, come later for another module, go and work, come for another module, and accumulate a credit system that will give them a final certificate once they finish all the modules. So we have introduced curriculum changes to introduce modularization of the curriculum, to introduce recognition of prior learning, and to introduce the dual training policy that mandates or that makes it mandatory for all TVET students to have industry experience before they graduate. Ni 2 terms, 2 terms. 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 Wacha nione mbwekse ya William Ruto jameni, mbwekse, mbwekse, mbwekse. Wale ambao wanaongea mambo ya elimu tafadhali. I want to reiterate what the party leader said recently. Please don't disturb us. We are trying to sort out the mess you created in the education sector. Tunataka tuwawekee kibao hapo, men at work. Don't disturb. Don't disturb. Wewe hapana sumbua sisi. We are busy fixing the problems that you left in the education sector. Ni fire, si fire. Ni fire, si fire. And you know what surprises us? The people lecturing us about schools, about education, during their tenure, all these problems were manufactured when they were in office. Shida ya curriculum, shida ya no teachers, no classrooms, all these problems were manufactured when they were in office. And the only track record we know of when they are in office, when they were in office, in that sector of education, is selling land for a school here in Nairobi called Ruaraka. Si kuna ardhi iliuzwa hapa ya Ruaraka ya shule? Si mnajua wale waliuza? Hao watu wawachane na sisi. Tutawaibisha. 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 Wewe nani wewe? Wewe nani? Wewe. Wewe. Wacha bwana. Thank you very much. So, wasituchokoze, na wakituchokoza tutawaambia vile tuliambia ule mwingine pale Mbere North. Tutawaambia vile tuliambia ule mwingine pale Mbere North. Simulisikia mambo ya Mbere North? Ile mambo ya Wamuthende. Wewe nani wewe? Wewe nani wewe? Wewe nani wewe? Wewe nani wewe? Bas. Number 4. Naomba tuketi jameni. Naomba tuketi. Number 4 ni mambo ya afya. Munajua ya kwamba we committed in our manifesto to change the health insurance program. Sio ati ni mambo tulianza wakati tumeingia ofisi. We said we will change it. Kwa sababu ile NHIF ilikuwa na Wakenya 7 million only. Na tukasema ya kwamba hii NHIF iko na ubaguzi. Wakenya ni 55 million, but only 7 million were covered by NHIF. Ilikuwa lazima uwe na mshahara, uwe na pesa, ndio ukuwe na insurance ya NHIF. Tukabadilisha, tukaleta mfumo wa kufanya kila mtu akuwe sawa. We need to equalize everybody, whether you have a job or you don't have a job. Whether you have a salary, you don't have a salary. You have a business, you don't have a business. You can fall sick, you need a medical cover, which will take care of you and reduce your medical bills. Today, we have a better scheme that is covering more Kenyans. Instead of the 7 million Kenyans that were covered under NHIF, this morning, under SHA, Taifa Care, 29.2 million Kenyans are registered. Na bado tunaendelea. By December tutafika 45 million. By June next year tutafika 55 million. Hiyo ndio inaitwa Universal Health coverage ya kila mtu. The challenges that we are addressing now going forward is about the availability of the right drugs in time. Already we have decentralized the availability of health commodities. Hakuna haja sasa kubeba madawa kutoka KEMSA inaenda county headquarters. Madawa sasa inaenda direct kwa dispensary, kwa health center, kwa hospitali. We have also introduced a national equipment support program where we are installing equipment in our health facilities, and we are targeting eventually not to concentrate only on level 6, 5, and 4 as was done previously, but we want to take equipment now to level 2 and level 3 hospitals so that they can have the right equipment. Tuendelee tusiendelee? In terms of primary health care, you know, one of the early policy decisions we made under President Ruto was to employ community health promoters. We have 107,000 CHPs in partnership with county government that are helping at the grassroots to educate the public and make sure that we prevent dangerous diseases from accumulating and from escalating to levels where they become expensive to treat. We have 107,831 CHPs supporting communities at the grassroots and helping them so that to prevent diabetes, to prevent hypertension, to prevent other diseases, and also to encourage those who have existing conditions to take their medicine and to change their lifestyles so that they can live longer, because if you have the right medical advice, even if you have a condition, you can live for a very long time. CHPs in Faya, see Faya. So we have done so much in the health sector. Because of time, let me go to number 5. Job creation. Kwa vijana. Niseme nisiseme. Niseme nisiseme. Many politicians are giving us lectures about unemployment and lack of income opportunities for young people. Many governments have come and gone, but we have never had a comprehensive, deliberate, intentional program run by government for creating jobs and income opportunities. This is the first time under the UDA administration. Niseme nisiseme. Niseme nisiseme. Munajua tuko na program ya affordable housing. You know we have affordable housing where we are building houses for the people of Kenya to give them dignity. We want to increase the number of Kenyans who live in decent places. That program will